Hi, my name is Kayla Buckles, and I'm going to be performing endotracheal care on Mr. Barry Bear here. So I'm just going to first knock knock, again without supplies, and I'm going to do hand hygiene. Hi, my name is Kayla Buckles. I'm going to be your student nurse today, and I'm going to be performing trach care on you. Is that okay? Yes. Okay, perfect. So now I'm just going to make sure I got my oxygen back here and my vacuum system, and I'm just going to test that real quick. Psh, psh, and it is suctioning. So I'm just going to get my kit together here, which I have everything in. All right. All right. So when I take my kit apart, let's see if we can see it this way. There we go. I'm just going to undo it this way. Right? All right, and I have my little box here that came into my kit. All right, and since I don't have no gloves on, I'm gonna go ahead and pour my saline into my box. And now I can go ahead and open up the catheter kit here and pull on the edges, make sure it doesn't bounce back. Alright, so since I got my sterile gloves inside, I'm going to go ahead and put my sterile gloves on, but I'm going to put it on my dominant hand first. So I'm going to do my right hand. I'm going to grab the cuff part of that, only the cuff part. I'm going to just slide my hand into it to where that part is only the one that's touching my skin. And now I'm going to go ahead and just reach underneath the other cuff part of my glove, and I'm just going to slide that in. Now I'm going to go ahead, I got those on, I'm going to go ahead and touch the sterile catheter. I'm going to do that with my one hand, and I'm wrapping it up. Right, so this is my sterile hand, this is my clean hand. I'm going to go ahead and connect it back here to suction. And I can suction on and off with this. So before I do anything, I'm going to rinse it. Well, not rinse, but I'm going to get a little bit of, let's see, saline in there and making sure that it's suctioned correctly, which it is. So I'm going to go ahead, and there's already oxygen on the patient, so I don't have to worry about that. But I am going to turn up the oxygen level just to hyperoxygenate them, just to be on the safe side. Grab my little tube back here again. And since this is in my saline, right? So I'm going to go ahead and just stick that down into the trachea, into the E-tube, until I feel resistance or until the patient starts to cough. All right, so I'm just going to come back out with the tube in a rotating motion, right? I got the tube out, so I'm going to go ahead and just rinse the tube. All right, sorry, it got a little bit stuck on my little net thing here. So now I'm just going to go ahead, and if they need any more suction, I'm going to do more suction, but the patient doesn't need any more suction. So, well, just be on the safe side, we're going to go back down again. Since it's already rinsed, we're going to keep going until we get every little bit, and we're going to rotate it since it's coming back up. And I'm twisting it, and it's rotating, right? I'm just gonna, ask the patient, making sure that they're breathing okay and everything like that, even though half the time they're knocked out anyways when this happens. So I'm just going to rinse, and I'm gonna put the patient back on the ventilator, right? Making sure that they can still breathe correctly, right? And I'm just going to go ahead and fold this up, making sure that I got it in my dominant hand. All right, I'm gonna fold that up into my sterile glove. All right, since I already disconnected it from the vacuum tube and everything like that, I'm just gonna close it up in my dominant hand, and I put that, and I degloved already. I'm just gonna take up underneath the flaps, deglove, right? Throw it away, wash my hands, and I'm gonna go ahead and clean up. Take everything and put that back down. And I would just turn off the oxygen, making sure that the patient is okay. I'd sit here for another few seconds, and I would just ask them if they're all right, and I'll again wash my hands, and that is endotracheal care.